This is the complex disease management. This second part of hour 3. I accidentally pushed the stop button. I'm so sorry. I'm going to describe a patient situation, and want you to tell me what you're going to do. If a patient's blood pressure is good before you start, a patient's blood pressure is good before you start to exercise, then you have him do some cycling. He starts breathing a little hard after 3 minutes, but he's talking fine, and he's really motivated to get home. You take his blood pressure, and it has risen 15 points systolic and 8 points diastolic. You think, wow, that's kind of a lot with 3 minutes of exercise, but our guidelines say that it's okay for him to rise 20 to 25 systolic and 10 diastolic. After within a minute, he starts to sweat and breathe harder. You take his blood pressure, and his systolic is decreasing, and is decreased by 30, and his diastolic pressure has decreased by 20. Well, during all this time, he's starting to mumble and get limp, and by the time you get to those measurements, he has fallen off the new step, and he's down to the floor. What are you going to do? Are you going to lay him down, continue checking him, and take him back to his room when he feels better? Are you going to lay him down, continue checking him, and have somebody get a nurse and come stat? Are you going to sit him up in a chair, continue checking him, and if his vital signs improve, resume therapy? So are you going to lay him down, continue checking him, and take him back to his room when he feels better? Are you going to lay him down, continue checking him, and have somebody get a nurse come stat? Are you going to sit him in a chair, continue checking him, and if his vital signs improve, resume therapy? What is the next question? What is the exclusion blood pressure from therapy? At what point, so you're going to take their blood pressure, or nursing tells you what is the blood pressure? We're not gonna do therapy. We're not gonna do anything with them. What blood pressure are we going to use precautions for activity? So we're going to, at what blood pressure we're going to be careful what activities we engage in. Name 3 factors that interfere with an accurate pulse oximetry reading. What does a person with 3+ dyspnea on the Ranchos Los Amigos dyspnea scale sound like? I've got to get my power source. Hang on a minute. Okay. What does 2+ sound like on the Ranchos Los Amigos dyspnea scale? As a general rule, what is the range of rise in our skilled nursing facility patients' diastolic blood pressure in number of millimeters of mercury that we want to stay within? This wasn't presented today. It was presented in, I think, Module 2. So what range of rise do we want to stay within in diastolic blood pressure? As a general rule, what's the range and rise in someone's systolic blood pressure in number of millimeters that we want to stay within? Okay. 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 Now, we're on this page. Yeah. This page. And some notes some things I wanted to point out on this are under the heart rate increases, the third point, the contraction of the working muscle massages the veins, increasing blood flow to the right atrium. To the right atrium. The point I wanted to make about this, educate our patients that exercise not only strengthens their muscles, but helps their circulation by making their contracting muscles press against blood vessels the way it was designed to be. That prolonged sitting and lying not moving contributes in many ways to their swelling and soreness. So there are more reasons than just strengthening their muscles. There are more reasons than just strengthening their muscles for moving their arms and legs around. It helps their circulation. It helps their blood vessels do what they're supposed to do. Helps their circulation. Then under systolic blood pressure increases. The first point, exercising a muscle tells the blood vessel in that limb to open up or to vasodilate and let the blood flow into it. Blood vessels in non-working muscles vasoconstrict. So in a way, exercising helps with blood pressure, and when I say in a way, it definitely does. Moving around, regular exercise helps to regulate blood pressure. But on a simpler level, moving the arms and legs helps blood to circulate. When people have cold hands and cold feet, that's why moving around helps them to warm up. It helps blood flow into that limb. The third point under systolic blood pressure. Greater systolic and diastolic blood pressure increases occur with exercising the smaller muscle groups of the arms versus the larger muscles of the legs. So you're going to see greater systolic and diastolic blood pressure changes when you're exercising the arms more so than with the legs. The smaller muscle mass and smaller blood vessels of the arms provides greater resistance to blood flow. So that's also going to account for the greater blood pressure changes. Under diastolic blood pressure, changes in diastolic blood pressure are usually seen only with upper extremity aerobic exercise and high resistance exercise. So this isn't to scare you, it's just to make you aware. It's just to make you aware that that's where you're probably going to see the greatest changes in diastolic blood pressure. Okay, then I wanted to go over this. In the back of the manual, I don't think you have this, so I'm going to need to get this to you. When you send that's how we'll do it. When you send your responses to the little Quizlet that I just gave you, I'll send this to you. Coronary is kind of a guidelines for exercising with coronary heart disease patients. Coronary heart disease patients should exercise at moderate levels of activity and should not become symptomatic with exercise at any level. The exercise should be terminated and the physician notified in the presence of one or more of the following symptoms: pain, discomfort in the chest, upper back, neck, arms, or jaw, unusual shortness of breath with exercise, nausea, dizziness, or fainting, an irregular pulse that they didn't have before, abnormal blood pressure response, decreases in oxygen saturation level below their normal level. And then this says patient requests to stop exercise. Well, in our setting, you have to take that with a grain of salt because they're gonna, they often request to stop exercise. So we're gonna have to evaluate that request. This says ideally the cardiologist or attending physician will provide the therapist and patient with safe exercise limitations, including heart rate and blood pressure guidelines. In the absence of a physician order to not allow the geriatric patient's heart rate to exceed a certain level, the therapist must use various clinical measurements and good clinical reasoning to determine if the patient's heart rate response to exercise is appropriate or if the intensity of exercise must be adjusted either downward or upward. Thus, we need to know how to use that Karvonen maximum heart rate intensity exercise formula. For example, if the exercise heart rate and blood pressure should return to normal within, and this guideline says 2 to 5 minutes, but as I told you during the other session, up to 10 minutes post-exercise. If not, the exercise intensity was too great. In prescribing exercise with the intent to increase cardiovascular conditioning and/or in determining the patient's tolerance to exercise or functional activity, the therapist should also consider the patient's facial color, respiratory rate, oxygen saturation, blood pressure, and perceived rate of exertion in addition to exercise heart rate. Kenneth Cooper, MD, states that the coronary heart disease patient's heart rate should not exceed more than 20 beats per minute above its resting level, and the patient's rate of perceived exertion, so their BORG, should not exceed 13, which is somewhat hard. So, and this comes from the Cooper Clinic Cardiac Rehab Program put together by Dr. Neil Gordon. And this is put in our training manual. I don't know if it's in the back of your manual of part 1, this book that you've got. I'll have to look in one of the part 1 manuals, but it's in the back of my training manual. But like I said, I'll send you this. I copied it verbatim out of the back of my training manual, and it's just a good guideline for working with cardiac patients. Again, I don't give you this guideline to scare you. In fact, I'm hoping that knowing the outer limits gives you some comfort in knowing how far you can push patients safely, so that we don't under rehab patients, knowing, okay, well, this is the outer limit. This is how far I can push them, so I know that it's safe to go X far. So that is all of today's training, and I'm sorry that I accidentally pushed the stop button and you had to do this in 2 parts. But hopefully, as I do these videos, I'll get more polished at it. Have a good day.